American health professionals HOVEN, a psychological epidemiologist, and George MUSA, a medical geographer attached to the Colombian University, both believe they can aid in the reduction of Guyana's high suicide rate through the launching of a wellness and suicide study slated to commence in October. According to the duo, who were interviewed by Nightly News on Tuesday, the project, which will involve the collection of qualitative data from Guyanese across the 10 administrative regions, will not only focus on Guyana's suicide rates, but will seek to discover the reasons Guyanese, especially the youth population, continue to attempt and commit suicide. Although this is not the first suicide study to be conducted in Guyana, HOVEN is adamant that this specific project is different from the other studies and as such will generate better results.
Many studies have only looked at psychopathology. That's not the only answer. It's an answer. But why are so many young people killing themselves? They are not mentally ill. Some of them are, but many of them are not. Why?
A 2014 report by the World Health Organization cited Guyana as one of the countries with the highest suicide rates in the world, 44.2 suicides per 100,000 deaths, 4 times the global average. In 2015, Guyana became one of only 28 countries to develop a suicide prevention plan in response to the report. The plan identifies factors that could contribute to the country's high rate of suicide. But despite the formulation of this plan, the country continues to record a high number of suicide deaths yearly. In June 2021, a 15-year-old student committed suicide, representing one in the dozens of other young Guyanese who have ended their lives by suicide. According to HOVEN, suicide rates among the young population is rapidly growing across the world, and this does not exclude Guyana. Therefore, the study will target persons from ages 15.
We're paying attention to world data, to Guyanese data. Who's killing themselves? It's an unfortunate situation, and the only way we're going to find out how to stop it is to ask a lot of questions, put the data together, and try to figure out what the problems are, and then try to do something about it.
The study is expected to be conducted in 3 components and will assess Guyana's suicide rates, the reason persons attempt suicide, and why persons who have committed suicide chose that route. Meanwhile, it was indicated by MUSA that the team is optimistic that this study will positively impact Guyana.
Well, definitely optimistic. Sure is a very strong word, but definitely optimistic that we can provide the information and work with the ministry to reduce the rates. Other countries have done it. Guyana can do it too.
In the interim, while the study will need to be completed to directly respond to suicide in Guyana, HOVEN believes that the government should do more to prohibit easy access to pesticides, which she said is vastly used by persons who commit suicide locally.
There's work that's been done in China, there's work that's been done in India that's been very successful in creating barriers to getting to the pesticides. That could happen irrespective of the study we're doing.
Reporting for the HGP Nightly News, Kendell Richmond.